The importance of health monitoring. While following a ketogenic diet, introduction, the ketogenic diet is growing in popularity. It has been and continues to be recommended as an effective method to help individuals lose weight, manage their blood sugar, or even address neurological issues. Empirical evidence demonstrates its potential to enable physical endurance during long-term athletic training. A ketogenic approach seeks to help the body metabolize fat as its primary fuel source by monitoring the intake of total carbohydrates and proteins, both of which are restricted when following an eating plan. As many people increasingly adopt the ketogenic diet, there is a critical situation to be aware of. While monitoring is essential when considering what foods you are consuming, the health of individuals adopting a ketogenic diet must also be monitored. Harmful side effects can be initiated when carbohydrate consumption is replaced with increased protein and fat. Nutritional deficiencies are also a factor of concern. The ketogenic diet is not recommended in an unsupervised state, nor are individuals with specific health backgrounds advised to take on this approach. This message, however, often needs to disseminate the zeitgeist of media and personal recommendations readily. People have varying responses to dietary changes, and health conditions, if present, may influence this further. Individuals' perspectives, motivations, and expectations towards food and eating can be affected. Balancing dietary goals and health with a predominantly restrictive eating plan can be difficult. Several steps can be recommended to provide an overall high-level approach to health monitoring for those following a ketogenic diet. This may include body weight or body fat percentage, blood pressure, waist circumference, and blood lipid markers such as low-density lipoproteins and high-density lipoproteins, among other markers such as fasting glucose and insulin access. Dietary monitoring tools such as urinary testing, blood ketone testing, and even breath testing, which track levels of ketone bodies, can be part of an individual's health monitoring toolbox. It is essential to have your health checked and your acknowledgement of any physical condition with your registered healthcare provider. Understanding the ketogenic diet. The ketogenic diet is a low-carbohydrate, high-fat diet used medically for almost a century to manage specific conditions. Typically, our primary source of energy comes from carbohydrates. When restricting carbohydrate intake to deficient levels, the body must find another energy source. Fat is broken down into ketones in the liver. These ketones body in the brain and are detected when in ketosis using a urine test, bite test, or blood test. Those using and making ketones, using fat as the primary source of energy, are therefore ketogenic. Diets containing a high amount of carbohydrates and fats are not ketogenic, as insulin will convert those nutrients into a preferred energy source. The macronutrient breakdown of the classic ketogenic diet is 77 to 87% fat, 12 to 18% protein, and 5% carbohydrate. This equates to 4 grams of fat for every 1 gram of carbohydrate and protein, almost 10 times the recommended daily intake of fats in an average diet. Shifting to use fats for fuel is an enormous metabolic change, and this cannot occur without a significant shift in choices of what foods are eaten and in what proportions. The diet is therefore detailed and individual. A deficient carbohydrate diet's relatively high protein content is based on the requirement to meet protein needs without providing an excess that is converted into glucose. Some ketogenic diets prescribe higher protein intake when keto adaptation has begun. Another of the many ketogenic diets is used. In those who have struggled to lose weight, are experiencing poor energy, and have mental fogginess, strategy inference can result in good adherence to a ketogenic diet. The individual adaptation may occur rapidly and will depend partially on the severity of the dietary restriction. As the ketogenic diet aims to draw nutrients from different food sources compared to the standard diet, some evidence suggests that it improves well-being. The appraisal's comments relate to weight loss, improved energy levels, and mental clarity. Hence, This is only sometimes beneficial, as with so many other approaches. If not done appropriately, high-fat diets can result in an increased risk of insulin resistance, type 2 diabetes, and prediabetes. They may increase triglycerides and other inflammatory markers in the body. The ketogenic diet is a medical regime, not a weight loss regime. It is therefore vital that anyone considering a change to a ketogenic lifestyle should seek experienced clinical health professional advice to prevent adverse side effects. Regular checkups. While the ketogenic diet has been demonstrated to offer developmental results, it does not mean that continuously monitoring one's health is not advisable. Regular medical checkups are indispensable. Routine visits may reveal problems earlier if any adverse effects of the ketogenic diet are incompatible with an individual's well-being. They can also function as regular health scores to monitor that a person remains within the range of levels recommended for good health. Clinicians also have opportunities during follow-up visits to answer patients' questions about the ketone levels reported in blood measurements taken at home. There is much more to be learned and taught by health professionals to prevent these novel meal plans from negatively affecting individuals' health, especially those with chronic diseases. Medical checkups are like built-in insurance policies. A wealth of parameters can be monitored during a health check, including weight, waist circumference, fat-free mass and fat mass levels, muscular fitness, resting energy expenditure, peak oxygen uptake, blood pressure, fasting blood lipid and glucose levels, and insulin sensitivity tests. Upper healthy ranges for total ketogenic diet intake and weight, and these health indicators are provided elsewhere. When a client's test result borders on or exceeds the healthy limits, in professional practice, responsible for holistic public health needs, advice is given on dietary changes. Purpose of regular checkups was for several reasons and to achieve various aims, anyone following a ketogenic diet should have regular checkups. The most important reason for regular health monitoring is to spot potential health problems early. Although many people experience excellent results when following a ketogenic diet, we always band together and make people aware of possible health complications. Regular visits to your doctor are necessary to assess how well you're following the diet and its effects on you. Some people need help managing their diet. If you came to see me, I would ask you about any side effects you were having, review your blood results, and suggest an electrocardiogram. If your cholesterol is high or rising, I might suggest a particle test to give us a more detailed look at what's happening in your blood. Changes in your kidney function would be something I'd want to track as well, although research suggests that while your kidneys may work harder in the first year of following a low-carbohydrate diet, you aren't putting your kidneys at risk. If your kidneys are impaired before you start a ketogenic diet, or at any point before or during treatment, you should inform your doctor. Its primary purpose, among other things, is to provide you with tailor-made guidance designed to help you avoid developing bad habits and health difficulties that some people with epilepsy have experienced. For most individuals, adherence to the diet can be strict. Even if you aren't seeing the expected outcomes, they need to know how to spot a potential issue and make the necessary modifications. They are a prudent option to make a significant health issue not as large as it is. Blood tests. The most common biomarkers to test on a ketogenic diet include glucose levels, electrolytes, and lipid profiles. By tracking these values that are easiest to test, you can ensure the body is tolerating the diet and no immediate gross problems can occur. Measuring blood ketone levels is a gray area. They provide value in determining the patient's metabolic state, but they may not be necessary for everyone, particularly metabolically healthy and lipid-prevented individuals. First and foremost, you must test glucose. New users of a ketogenic diet, pregnant women, breastfeeding women, children, and those with a history of hypoglycemia, seizures, or mental disorders should undergo routine glucose testing. Being in optimal ketosis usually means that any glucose interpretation below 3 mmol is potentially threatening. The second most important test is an electrolyte panel. check both for hydration status problems and to ensure normal levels of all essential electrolytes such as sodium and potassium. A total net electrolyte discharge can also be beneficial. Still, it is unlikely that subtle changes would not be found on a basic metabolic panel. Complete fatty acid analysis should also be done, but most patients rarely perform it. After 3 months, you should offer a full lipid panel to any adult. This could lead to freedom from statin drugs, especially if combined with raised HDL and lowered triglyceride levels. Regarding energy percentage, fat consumed, and lifestyle factors such as weight evolution, activity fasting, etc., the reaction to keto raises in protein and carbohydrates over health context. Test the same things, then undergo another test, and compare outcomes to see if health has shifted after making the necessary adjustments. Moreover, a blood examination helps ensure an individual's nutritional status and vitamin deficiencies, especially in people who eat fewer calories and fewer vegetables. Knowing electrolytes, as well as unique iodine and iron markers, may also help in guidance. Apart from intramuscular creatine, 2 electrolytes must be examined in the patient before starting a ketogenic diet: potassium and magnesium. Before KDT induction, supplemental magnesium and potassium correction is recommended even for those with normal serum electrolytes. Managers with high NIA will advise patients to stop taking magnesium-containing muscle enzymes. Data suggests that magnesium levels should only be measured every 6 months and supplemented as required. Administering a full electrolyte panel, sodium, potassium, magnesium, and phosphate, is usually necessary until patients go through the diuretic LEX in the future. The lack of a significant electrolyte panel can be a lack of good references for future detection of severe electrolyte issues. Establishing standard daily supplementation for calcium, magnesium, vitamin D, and K may also be beneficial. In addition, it can help with osteoporosis. Significance of blood tests. Because it's not routine for everyone, the significance of blood work while following a ketogenic lifestyle involves more than just checking up on blood sugar levels or cholesterol. It is a snapshot of what's happening in your unique metabolic world. Our monitoring tools also enable us to track the effectiveness of our low carbohydrate ways, since there are no lab values considered normal for ketosis in mainstream care. Another benefit of lighting up the lab is identifying and correcting any adverse effects of quickly transitioning to a low-carb, high-fat ketogenic diet. In the instance of the ketones in a blood test, the blood test reveals results that can detect specific implications of choosing the ketogenic way. Some of the areas addressed may provide early warning of potential issues when transitioning to this crucial low-carb, high-fat method of eating. Regular analysis uncovers meaningful and beneficial understanding in more ways than ranking disease sirens. It further helps determine changes in habits as needed for tailoring this way of eating to meet one's health goals, be it the pursuit of ketosis, initially reversing hypertension and type 2 diabetes, enhancing sports performance, lessening migraines, or others unique to you. Therefore, blood tests are not only an excellent annual rule for everyone, they are a vital player in the overall plan of eating when low carb. Tracking symptoms. A straightforward way to monitor health while on a ketogenic diet is to track symptoms. Education is essential, especially at the beginning of the diet, when individuals adapt to ketones. Providing a list of common symptoms that signal the adaptation process, also known as the Keto Flu, can be helpful. If after a few weeks an individual uses a symptom tracking sheet, they may begin to see the reduction or absence of these symptoms. The Keto Flu includes symptoms such as fatigue, headache, nausea, dizziness, sugar or carbohydrate cravings, or brain fog. Using the Keto Flu to detect signs of early liver damage caused by an increase in fat consumption helps to separate typical responses from more severe health concerns. Lower carbohydrate diets also remove protective phyto and other chemicals from ketone metabolism and deplete sodium stores, which can create flu-like symptoms. This highlights the importance of monitoring individual symptoms, which can be used to rule out other health problems early. Other reasons symptom tracking is essential are that individuals may have food intolerances or adverse reactions to ketogenic foods. For example, excessive amounts of MCT oil may lead to digestive upset in some individuals. Some individuals may also respond differently to organic acid excretion, a sign that their bodies have abnormal metabolism. Using symptom tracking will also allow individuals to increase their awareness of what occurs in their bodies when they consume food. For example, after eating a given food, an individual may become sleepy or notice changes in their digestive health. Increasing the understanding of one's body using symptom tracking can increase confidence in knowing what to eat for a healthier response. A symptom tracker is one tool used to monitor health. Monitoring how individuals' symptoms change over time can associate these with health measurements, such as gallbladder function or vitamin insufficiency. Rather than following a guide or program defined by others, becoming aware of one's body is a form of empowerment that puts an individual back in control of their health. Symptom tracking is something that anyone can do, regardless of financial means. Even children can become involved in the symptom tracking conversation. Providing personalized tools to support symptom tracking is needed. It could advance our understanding of how different people respond to a higher fat diet in the long term. The information gained might explain the different opinions researchers hold about how this diet affects health, as the key may depend on how the diet is applied. Benefits of symptom tracking. So why is it essential to track your symptoms and not ignore them? Paying attention to symptoms and how they change can help give you helpful information about your body and health. If you have been tracking how you feel and what you've been eating for a while, you can see patterns in how symptoms unfold and change over time. Do they come and go at the same time each month? Do you get the same symptoms after eating lots of a particular food? By documenting these signs, symptoms, and possible dietary triggers, you can make more informed decisions about what needs to change to give your body its best performance. Also, from a mental health perspective, tracking has additional benefits in that it can help keep you motivated and provide another layer of accountability to those healthy habits. It can also help your healthcare provider during a medical evaluation. For example, having taken some objective measurements can give context to things your healthcare provider may already be using to evaluate your health, such as your height to weight ratio, blood pressure, resting heart rate, and cholesterol levels, or in other words, give them more insight into things that matter. Finally, making the connection between food and health is the first step toward better health. This way, we ensure we don't miss any underlying health conditions that could be stopping us from achieving our full potential in this way of eating. Adjusting your approach, so be flexible and ready to adjust as your ability to monitor your health improves. When beginning a ketogenic diet, the best approach is to use the standard ketogenic diet as written and adapt your behaviors to turn the diet into a lifestyle plan as you gain experience and learn about your health. Be bold in changing your approach as you gain more knowledge and your health improves. Even the best dietary strategy can and usually does need personal modifications based on many factors, including your current state of health, blood tests, quality of life, lifestyle, and many other factors. Monitoring is essential to tell if your diet needs to be adjusted. Common examples of factors that may indicate a need for dietary modifications include a stall in weight loss and weight gain after a prolonged stall, signs of hypothyroidism or any complaints related to low thyroid, low energy, and any other health concern that may emerge over time like constipation, menstrual irregularities, gallstones, high cholesterol, skin rash, etc. Only some people will need to adjust their diet and lifestyle from the standard KD, as experience and health will tell you the best ketogenic diet strategy for yourself. It is crucial constantly to evaluate the effects of your dietary practices, finding the sweet spot between healthful and satisfying. If you can create the diet you find easiest to follow, and that satisfies you most while lowering your chronic disease risk factors. Being able to fit a KD to your needs can make it a lifelong commitment to health and increase the likelihood of success on a KD. Importance of flexibility. In the context of the ketogenic diet, one of the many elements the books cannot address is the importance of flexibility. It is fantastic to have measurements of your blood levels and great recipes, but maintaining an attitude of flexibility is equally important. Dietary choices daily are not the only necessary part of high-level nutritional planning. Even when understood, regression analysis is followed, and adherence to an exact regimen is maintained. Flexibility, I prefer adaptive to flexible, is itself a decision in the highest form of dietary choices. True adaptability involves decisions made in response to ongoing results of experimenting the feedback from our bodies. Flexibility enables, and has helped me, to use the ketogenic meal in a therapeutic capacity while continuing to function in everyday life. Being attached to a rigid set of rules sets us up for feelings of failure and can foster a start mentality regarding diet and health. Growth comes from experience, and knowledge comes from failure. Reversing our relationship with these will allow absolute victories. Overall, success is found in absolute commitment to the ketogenic meal with flexibility in feeding time. Science is not dogma, and the science behind the ketogenic meal is inexact. Through ongoing experience, understanding, and ultimately a comfortable long-term investment in a metabolic way of life, not in the rule book, is success.